Hello and welcome to this lecture entitled What Medicine Can Learn from Savile Row. I'm Roger Kneebone, Professor of Surgical Education and Engagement Science at Imperial College London and Gresham Visiting Professor of Medical Education. And I lead two centres. One is the Centre for Engagement and Simulation Science at Imperial College London. The other, the Centre for Performance Science, jointly between Imperial and the Royal College of Music, a very close next-door neighbour. And over the last 2 years or so, I've given a series of lectures which I've entitled Performing Medicine, Performing Surgery. And the idea I've been exploring there is that medicine is not either a science or a set of skills, or indeed performance, but an amalgam of all of those, and it takes place at an intersection between the three. And I think as patients, it's the performance that we're most acutely aware of. Now, of course, the idea of performance is nothing new in medicine, particularly surgery. And over centuries, there have been performance spaces. So the Anatomy Theatre in Padua, opened in 1595, is clearly designed so that people can watch what is going on with the dissection at the bottom. A couple of hundred years later, the operating theatre at St Thomas's Hospital in the 1820s also adapted for onlookers, for spectators. 50 years later, Thomas Eakins' painting of the operation by the surgeon Thomas Agnew of a partial mastectomy, we can see that there are crowds of medical students and young doctors all craning their necks to see what's going on at the University of Pennsylvania at the time. And then in the early 20th century, in 1920 or so, this was the operating theatre at the Middlesex Hospital in London, now demolished. And you can see again, there is provision for people to watch what's going on. So this idea of performance, I think, runs through medicine. And it's an idea that I explore in my book, published by Penguin in August, a couple of months ago, entitled Expert, Understanding the Path to Mastery. And in that book, I explore ideas around what it is to become expert, but also in many cases what it is to perform. I draw on many people in that book, many experts. And if you're interested in my Countercurrent podcast series, you will find conversations with many of the experts who appear in the book. There's the link. And if you just put in my name, Kneebone, and Countercurrent into any search engine, it will appear. So in this book, in my book Expert, the idea I explore is that becoming expert is a pathway. And I draw on the medieval description of three processes, starting from being an apprentice when you know pretty much nothing, you join somebody else's workshop, you do what you're told. After a number of years, you become independent. You go out into the country as an independent craftsman. You journey. You're called a journeyman. And you apply your trade or your craft. And then finally, in the later stages of your career, you yourself become a master, you have apprentices of your own, and the wheel comes full circle. And I should point out that these terms I use because they're familiar to many people. Nowadays, of course, they are not gendered. Journeyman and master apply equally to men or women. But it's a terminology which I think many people are familiar with. But although this model is familiar, I think it has limitations because it describes a series of stages, but it doesn't really explain what goes on the inside. So in my book, I use those three stages. There they are at the top of this diagram. But I divide those three stages into a series of descriptions, of explorations of what are the processes that people go through themselves as they move along that path towards becoming expert. And I'm going to explore a number of those today when we look at the parallels between two apparently unconnected areas, bespoke tailoring and medicine. So the first of these stages, being an apprentice, involves spending a lot of time doing stuff that you may not particularly like. You often don't like it, but you have to do it anyway. And in the process, you become familiar with the materials you're using, the tools, the instruments, and of course, the space you're inhabiting and the other people you work with. The next phase, becoming a journeyman, I think is particularly interesting because here there needs to be a shift from your approach as an apprentice, where it's all about you and the skills that you're acquiring, and very often your wish to show off that you've acquired them. Whereas when you become independent, you have to make a change, and you realize that all those skills you've acquired are actually in order to do something for somebody else. Now, that may be a patient, if you're a clinician like me. It may be a customer or a member of the audience or a client. It may be all sorts of people. But there needs to be that shift, which I've called, it's not about you, it's about them. But at the same time, there needs to be a growing sense of who you are, of your uniqueness. And in a sense, that is about you, because that's you developing your individuality as a craftsman, as a performer, as a clinician. And again, in this segment of the path, we need, I think, to think about what it is to start to take responsibility for the mistakes that we will all inevitably make, and how we get out of them, how we restore them, how we recover. And then the final stage is the stage of passing it on, the stage of passing your knowledge and your skills, and particularly your wisdom, I think, not only to apprentices or students, to individuals learning from you, but to your field as a whole, and indeed to society more widely. And I think we're very much aware at the moment of the need for experts and the relationship, sometimes the troubled relationship, between us as members of society and the experts on whose wisdom we often depend. And in order to explore these ideas this evening, I'm going to introduce you in a while to my friend and colleague Joshua Byrne, who's a bespoke tailor. Now, the insights I've had from working with Joshua over the more than 10 years since we first met run through my book, and they run through many of the ideas that I've developed over the course of these lectures. And here they are on the cover of my book, Expert itself. Joshua, I met, as I say, over 10 years ago, and when we first met, I knew nothing about tailoring. He explained to me, first of all, some of the basics. He explained that there are really three kinds of suits or jackets, clothes for men particularly. One is off the peg. You go into a shop, you want to buy a suit. You have a look at the suits on the rack. You decide the one that you like the look of most, the design, the material. You find it in your size, if you can. You buy it, you take it out of the shop, and that's it. Made to measure is a different process, where you, again, choose something from a suit that has already been designed and made, but you have it created for you in exactly your size, very often using the kind of material that you yourself have chosen. The third, bespoke, is actually completely different. And what I've learnt from working with Joshua is that bespoke is not just a sort of superior kind of made-to-measure. Bespoke is a different process where, unlike those other two, where a suit has been designed in advance and you simply have one made in your size, bespoke is a process where an expert craftsman works with a customer or client to identify what that person needs and create something for them and for them only, through a series of fittings, when the suit is gradually adjusted and shaped and refined until the final version is exactly what the customer wants. And we're going to talk much more about that process, because I think it has fascinating parallels with clinical practice, particularly with my experience as a general practitioner or a family doctor. But I'm going to take you back to the first time I met Joshua. He invited me over to his studio, and at first I thought that we would find common ground in the stuff that we do with needles and threads. He clearly uses needles and threads in his work. I'd spent a lot of time by that stage as a trauma surgeon, doing a lot of operating and joining parts of the body together using needles and threads. In those days, it might be segments of intestine or arteries and veins, all kinds of structures. And so I asked Joshua just to show me the kind of work that he does. And here he is. We see a glimpse of him showing how he handles a jacket when he's making changes to its collar. So he's sitting with his work on his knee. He's handling these different layers of cloth. And when I saw him do that, it made me think of my time in the operating theatre. And I thought, well, it looks pretty similar. And he makes it look very easy. And how difficult could it be? So I asked him if he'd let me have a go and tell me what he thought. And here's what happened.
So I've gone through...
You've got the pad, so you have to go back and take that out.
So do I need to pull
so
it all
you
out?
take the needle out and undo the stitches. If you use the needle, because otherwise that's the wrong stitch to pick out.
Yeah.
The back end of the needle is easier for that.
And to me, this was a profoundly disquieting experience, because here I am floundering, unable to do what I thought would be very straightforward. And it was a while before I realized what the reason was. And I think the reason is that I thought I was good at sewing, but I wasn't good at sewing. I was good at sewing in a particular context. I was good at sewing in this environment. I'm over here on the right in the 1980s, on the outskirts of Johannesburg in southern Africa, in a very large hospital, carrying out a big operation, as you can see. But I'm standing up under a bright light. I'm wearing surgical gown and gloves. I've got people over on the left of the screen. You can see the scrub nurse, that crucial member of the team, who is handing me instruments and taking them away. I've got somebody opposite me assisting. It's a completely different thing from sitting down, as we saw just now with Joshua, and a garment with many layers, a straight needle, nobody handing you things. It's a different process altogether. And so it made me realize that although there are similarities at one level, there are profound differences as well. And exploring those differences has helped me shine a light on what it is to become expert, and indeed what it is to be a clinician. So fairly soon, Joshua told me a bit about how the world of tailoring works. He explained that there are two kinds of tailors. There are making tailors, sewing tailors, who do the kind of work that we've just seen, who put garments together, who shape them and sew them. And there are cutting tailors, who design garments and who interact with customers. Now, making tailors don't have anything to do with customers. That's the job of that's the role of the cutting tailors. It's a bit like the distinction between builders, like the making tailors, and architects, cutting tailors. And mostly a tailor will do an apprenticeship for 5 years, perhaps longer, in one of those or the other, but only one. Joshua was highly unusual in that he has done an apprenticeship in both, so he has an insider's understanding of all these aspects of the tailor's craft. And over the years that followed, I invited him on a number of occasions to come and explain the world of tailoring to, in this case, a group of surgeons on a master's program in surgical education, which I lead at Imperial. And he explained the relationship between real-life, three-dimensional human beings and the representations of them that tailors use. We can see brown paper patterns on the table in front of him, for example, and there are symbolic representations of this kind from a book that characterize the kind of work that he is going to do and allow him to communicate with other tailors. But his work as an apprentice was very much about spending time, lots of time, months and years, just learning skills. It wasn't so much, he told me, that the concept was difficult. He could understand what he needed to do, but actually being able to do it, becoming skilled in his hands and his body at being able to do it, was a very different story. And I mentioned here in this stage of the expert pathway, the apprentice stage, doing time, that need to spend a long, long time just doing stuff, and also using your senses and becoming familiar with space and other people. And I think all these things are interconnected. And Joshua gave me an example. He talked to me about how his master made him learn how to make pocket flaps. Now, pocket flaps are not at all as easy as they might sound. They have to be very carefully made so that they fit with the curvature of a jacket. They don't splay or they don't wrinkle up, and they require precision and great craftsmanship. And Joshua said that for months and months he would be there at his bench making yet another pocket flap. His master would come over, look at his work and just say, no, not good enough. Wouldn't tell him why. And Joshua had to keep on making more and more pocket flaps until eventually he himself recognized when he was doing good work, and he developed a different kind of understanding. And of course, in the years that followed, there were many, many other tasks of that kind that he had to do. But for Joshua still, pocket flaps are a kind of shorthand for, in a sense, for boring, repetitive work of no apparent value at the time, but which turns out in retrospect to be absolutely indispensable, because not only did he learn in this process to make pocket flaps, and they're an essential part of being a making tailor, but he also learned all kinds of stuff about the materials, the textiles, the fabrics he was working with, what they felt like, what they would allow him to do. And that's something that I'm very familiar with in the world of surgery. So I'm going to show you a brief clip of a surgical operation now where a very experienced surgeon, one of the former presidents of the Royal College of Surgeons of England, indeed, on the left of the picture, is teaching a much less experienced surgeon how to do a part of an open operation for gallbladder removal, where he's talking about what you have to do when you take the gallbladder off the liver. And that's something that surgeons have to do all the time, is to interact directly with living human tissue.
So that's the cystic, and once you get the gallbladder developed coming away from the liver bit, there you go, the centre plane then. And there's this reassuring thing where you put a finger in, just try that, just ease a finger in there, feel the...
And I think that's very interesting, because he says there's this reassuring thing where you put a finger in and feel the... and then he stops talking. And I'm sure he stops talking because he's reached a point where words will no longer convey what he wants to convey. What he wants to convey is a feeling, and you can only really understand that feeling if you felt it yourself. And I know from experience that there is exactly that. You put your finger in between the liver and the gallbladder, and you have to peel it off, and you have to recognize how hard you can press, and when you have to be firm, when you have to be gentle, all that kind of thing. And I think this is a characteristic of becoming familiar with the materials that you're working with. In the case of tailoring, the textiles, the cloth; in the case of medicine, living human tissue. And I think it's probably the same for pretty much every area of expert practice. The next stage is the journeyman stage I mentioned, where you have to make that transition I described earlier from thinking your focus is all about you and the things that you're learning to do and showing other people that you can do them, to the people that work is for, to your customer, your patient, your client, your audience. And at the same time, developing your individuality. But I think in this stage particularly, you start to work more with the unexpected. You're taking responsibility for things that you try out and do that may not have been done before. You're taking responsibility for the errors that you might make and for putting them right and for dealing with that when it happens. But you are dealing with uncertainty. And I think in this world of tailoring, as in medicine, there's something very interesting about two different kinds of approach. And I'm going to draw here and read a little bit from a work by David Pye, the well-known furniture designer in the 1960s, who in 1968 published an influential book called The Nature and Art of Workmanship. And he distinguishes between two different kinds of workmanship: the workmanship of risk and the workmanship of certainty. Now, he's not talking about risk in the sense of the risk of poor quality or anything like that. It's a different framing. And I'm just going to read you a couple of paragraphs from what he says. He says, "If I must ascribe a meaning to the word craftsmanship, I shall say as a first approximation that it means simply workmanship using any kind of technique or apparatus in which the quality of the result is not predetermined, but depends on the judgment, dexterity, and care which the maker exercises as he works. The essential idea is that the quality of the result is continually at risk during the process of making. So I shall call this kind of workmanship the workmanship of risk, an uncouth phrase, but at least descriptive. It may be mentioned in passing that in workmanship, the care counts for more than the judgment and dexterity, though care may well become habitual and unconscious." And he goes on to say, with the workmanship of risk, we may contrast the workmanship of certainty, always to be found in quantity production and found in its pure state in full automation. In workmanship of this sort, the quality of the result is exactly predetermined before a single saleable thing is made. The most typical and familiar example of the workmanship of risk is writing with a pen, and of the workmanship of certainty, modern printing. In principle, the distinction between the two different kinds of workmanship is clear and turns on the question, is the result predetermined and unalterable once production begins? And I think this is a very interesting idea because in all my conversations with Joshua, this idea of creating something through the process of bespoke that has not been done before, and where there is uncertainty, and where the final result cannot be completely known until it happens, makes sense to me as a clinician, where again, I think the process is one of bespoke, where two people come together in a relationship of trust and integrity and care to come up with something that works for both of them, but particularly for the customer or the client or the patient. I'm going to skip over the final stage of passing your knowledge on because I'm sure that's something we're going to explore in the second part of this talk. But I just want to say a few words then about this idea of what bespoke might mean in the context of medicine. In Joshua's context, I was fairly clear once I'd spoken to him on a number of occasions how it would work, and then a penny dropped with me that as a GP, as a family doctor, I think I was doing something very similar when I was consulting with patients, because we would start off by trying to work out what the problem was. And then within that relationship of trust and care, I would come up with some possible solutions. We would agree which of those to go for. We'd see how it worked out. It might be prescribing some treatment. It might be referring a patient or doing some tests. It might be all sorts of things. But it would involve moving the discussion on a bit. And then we would see how that goes. We would review it. We would make changes if we needed to. And it started to sound to me very much like Joshua's description of creating a suit through a series of fittings. And at about that time in the 1980s, I had just changed from being a surgeon to starting a new training as a family doctor. And I encountered this book by the very distinguished GP and author Roger Kneebone called The Inner Consultation. And to me, this was a revelation because Kneebone's book, it didn't have much in it at all about the kind of medicine that I was used to from my textbooks. It didn't talk about how you make a diagnosis of pneumonia or psoriasis or how you treat high blood pressure or what you do with people with heart attacks. It didn't, that wasn't its focus. Its focus was to look at the consultation between a clinician and a patient as a performance, really. And Kneebone, at the center of Kneebone's book, is a series of 5 waypoints that he identified for keeping track of where a consultation has got to. He started off by talking about connecting, that need to establish a rapport with your patient, whether it's somebody you know quite well already or somebody you've never met. Connecting with them and trying to work out what is the problem that they've come to talk to you about. The next stage, summarizing, is where you reach a point where you might say something like, well, I think from what you've told me that the problem is this, but I might be wrong, and please tell me if I am. And you reach a point where you both agree on what is the issue that you're trying to deal with. The third stage he calls handing over, and that's where he talks about handing over the agency for what happens next. So you might say, well, I'd like you to take these pills and we'll see what happens after a week or two, or whatever it might be. There's an agreement that something else will happen that will move things further forward. But of course, things don't always go according to plan, and so you need to have a safety net. You might say, well, I'm expecting that after 2 or 3 days you'll start to feel a lot better, but if you don't, or if anything else worries you, I want you to let me know. I want you to give me a ring or come and see me, or whatever. Safety netting. And then there's something particularly interesting, I think, that Kneebone pointed out about the need to focus not only on the patient you're with, but on yourself, because certainly in my own experience as a GP, towards the end of a busy morning or afternoon in the consulting room, having seen many, many patients, some of them with very serious things wrong with them, I could build up a sense of sort of of emotions and sometimes distress or hurt or frustration, and sometimes I would know I was running late. All kinds of things were going on inside, and I needed to address that so that didn't dominate the next consultation with a different patient. I needed to take account of my own internal state, and I might need to have a break for a couple of minutes, talk to a colleague, open a window, all sorts of things, housekeeping. And I think all these ideas play out into my ideas about what it is to become expert and how people who have become expert have developed ways, I think, of managing these ideas. And we're going to explore some of them in just a moment with Joshua. I'd like to point out again my countercurrent, particularly with him, where we explore in more detail some of these ideas. So if you are interested after this talk, do please have a look at this podcast. But for now, it's a great pleasure to stop talking here at the rostrum and to introduce my friend and colleague, Joshua Byrne. So, Joshua, welcome to Gresham. I said a little bit about you, but I haven't said very much. So I thought maybe could you just give a sense to people about how you became a tailor in the first place?
I became a tailor. I was studying economics and agriculture at Edinburgh University, and I went one evening to see a film, and one of the scenes within the film had a tailor working, and something engaged with me from it. And so I explored the possibility initially of doing it as a hobby. So the following few days I went to the tailors in Edinburgh to see if it was something you could do on the weekend. And it became quite clear that wasn't quite how it worked, and that either you did it or you didn't do it. So the investigations quite quickly made it clear I'd have to go to London, and the university very kindly gave me a 3-month period to go and try it and see if I wanted to carry on doing it. So I found an apprenticeship, very luckily, as a jacket maker, coat maker, and embarked on it and had a 3-month trial, which then turned into a...
So I mean, this is a bit of a leap, isn't it? So there you were in the middle of a university course, studying agriculture and economics, and it sounded as if it was one of those things almost by chance.
Oh, completely. Yeah, it was completely by chance. It was, as I say, going to see a film. I didn't even know the film. It was somebody else wanted to see it. And then just this one scene within it that somehow clicked. And
did it turn out to be the kind of thing you thought it might be from that film?
No, not really. I mean, aspects of it, but I think it seemed more peaceful than it is. But
that probably applies to a lot of jobs, doesn't it?
Exactly, yeah. But no, my grandfather was a bookkeeper in a tailor's when I was very small, and I would go and spend the day with him at work. He would leave when he was working. He'd leave me in the workshop with the tailors, and I suspect that may have had something.
Oh, I see. So you had that sort of sense.
Put that together a lot later, even after I started as an apprentice.
Right. I see. So you'd kind of been aware of that world of, I suppose, cloth and textiles.
Well, not consciously. I mean, it wasn't something we talked about, and it wasn't. It was, but that's something that kind of came to me a bit later.
So you became an apprentice.
Yeah.
And first of all, to a jacket maker. So that's the... Have I got this right about the making tailors, the sewing tailors?
Yeah, no, exactly. So as a making tailor, you receive a package with all of the fabric cut into pieces and marked with chalk to indicate how it needs to be made, and all of the other materials needed to make it, from the canvases for the interlinings to the linings to the buttonhole thread to...
Because I mean, with a jacket or so, there's quite a lot to it, isn't there?
There's quite a lot to it.
Much more than you see from the outside.
Yeah, exactly. It's quite surprising when you first start in kind of how many layers there are, and as you kind of described with the pocket making, you don't always understand why you're doing something. But you're doing it because you're told to do it. Yeah,
and so this is a really interesting one, isn't it? From this early stage of your apprenticeship, when you're doing something that you have to do because someone tells you, but you don't quite know why, as you say, and you don't quite know how it works. But you're kind of having to mimic what other people are doing without necessarily understanding it, aren't you?
Yeah, and I think quite often people will just carry on mimicking it indefinitely. They don't actually go past that. They know that that's what they're meant to do because that's what they were told, and they will repeat that endlessly and make nice work from doing that. But it always has a limitation, and it's less of a limitation in the making side than the cutting side, because if you've been taught a repeatable way to make something well, that's something. I don't think it's really enough, but it's something.
So there's something interesting about knowing when you're getting good enough.
Yeah.
And I mean, I said briefly that there's a difference between the knowing what to do and being able to do it.
Yes.
Thing. And I remember you talking to me once about that.
Yeah.
Because it's rather different from university study, isn't it? This kind of apprenticeship.
I found it the opposite. I found it a real challenge because with academics, obviously you learn something, and to a certain degree, you then move on to the next thing. Okay, you might look at it in more depth, but you're looking at more and more and more. Whereas with a craft, you're learning something. You learn how to do something really quite quickly because it's quite a simple thing to explain, and then you have to repeat it endlessly, not, as you described, not always understanding what needed to be done to make it better, and quite often not being able to see the difference between what you're doing and better.
Yeah, I mean, I was thinking about that when I was writing my book, Expert. I was thinking about how that played out in my own experience, and I give an example of learning to take blood from patients when I was a medical student, and I was sent off one Sunday morning to do the bloods, as it was called, and somebody just stuffed a whole load of syringes and needles and little tiny bottles in my hand and said, okay, showed me on one patient how to take blood, and off I went, because this was the 1970s, different world. And so I tried it on the first patient, and it was fine. It was really easy. And then I realized when I started doing it on more patients that actually it could be incredibly difficult to do. No one had really explained to me how you deal with patients where it is a difficult procedure to do. And of course I was really, really worried about causing harm and hurting people, and it was an extremely unpleasant experience in many ways for me particularly, as well as some of the patients, I suppose. But in a sense, it was only by doing these procedures again and again and again that I eventually became skilled at them. And again, rather like you, it wasn't that I didn't understand the principle, it was that I couldn't do it.
Yeah.
And I might be able to do it once, but I couldn't do it consistently and repeatedly in such a way that it minimized discomfort. All of those things had to come together, and it took a long time. I mean, that's only one example, and there are many things in medicine, but it made me think when I was talking at the beginning about medicine being a science and a set and skills and performance, that all these things come together, don't they?
They do, yeah.
And some of them happen at different speeds.
Yeah, and different speeds for different people.
And different speeds for different people.
Some people can get the feel for it depending on previous experience. If you've been involved in sculpture and stuff like that, I would imagine you would get a sense in your hands more quickly.
So that sense in your hands is an interesting thing, isn't it? Because it's very hard to put into words.
Yeah.
And presumably when you were making pocket flaps or whatever it was, you had to develop that sort of felt awareness.
Yeah. Yeah, no, exactly. It is I'm not sure how you explain it, to be honest.
Yeah, I mean, I guess maybe that's why it just takes such a long
time. Exactly. I think possibly you could explain things in a little more depth, but it was quite typical of apprenticeships that you weren't always, because the person that you're working with has their own work to do, and they're not a teacher who is there solely to teach you. They're there to do their job, and they're teaching you on the side almost.
Yeah. And I remember you said something very interesting to me a while ago when we were talking about work that seems uninteresting. Mm-hmm. And you said something like, you can just cope with doing uninteresting work, or you can change things around.
Yeah. Yeah, very much so.
Say a bit about that.
It's a little bit like I quite like cricket, and when I came back to it, found fielding quite tedious. And then one day I thought to myself, well, most of the time that I do this, I'm going to be doing this particular part of it. So either I learn to like that part of it, or I might as well stop the whole thing. And it's a bit like that with anything, is that it's not a question of enjoying what you do, it's finding a way to enjoy what you're doing. So even if it's something that's really tedious, when you first start to do it, you try to find a way to find it interesting. Try to challenge yourself. So for example, putting on buttons can be not the most fun thing. But you can find ways to make it more enjoyable by trying to find ways to improve in what you're doing. And I think it's having an engaged mind in what you're doing that makes it enjoyable, rather than kind of, I've got to put these on again.
I mean, I think that goes back to what I was saying about that apprentice, journeyman, master journey can look simpler than it actually is.
Yeah.
And it's actually how you approach being in one of those stages that makes all the difference, isn't it? From what you were saying, you could have just had a really boring, tedious time being told off all the time and not really understanding it.
In the early stages, it was a bit like that. And then at some point, something clicks. You go, okay, this isn't working like this. So somehow I need to make it work.
I mean, I had that experience as a student and then a junior doctor learning surgery, where for an awful lot of time I would be in the operating theatre hanging onto a retractor like this, bigger one usually, so that somebody who could see the operation, namely the surgeon, could see the bits they needed to, and I very often couldn't even see the other end of it.
Yeah.
And rather like you, to begin with, it just seemed terribly tedious, and I got backache and things. But then I realised that actually the only way to make sense of that was partly to recognise that I was an important member of the team and that the work I was doing was necessary work, but also to see what I could learn, to try and concentrate on the operation, to see what I could learn from what everybody was doing around the operating table, rather than just getting bored.
Yes. No, exactly.
And to some extent you have control over that, don't you?
You do. I think you have, very much have control of that. And also, seeing people and kind of trying to also learn from things that people don't do very well.
Yes.
You can learn from both the things that people don't do well and the things that they do well.
So maybe it's about being observant and sort of widening your focus a bit, because when you're beginning, I think you are focusing a lot on just struggling with those basics, aren't you? Like learning to play scales if you're starting with piano or something.
Yeah.
And I guess learning to use these tools. I mean, certainly in surgery, I had to learn to use instruments, and I see you've brought some of your instruments. So maybe say a bit about the kind of physical work that tailoring involves.
So the main things are cutting and these are tailoring shears, which are the smaller ones on the table for sewing tailoring, which are for cutting thread and some materials. So the main things are cutting, sewing, and then shaping with steam usually. I don't have an iron with me, but that's but the sewing shears are quite different from the cutting shears.
So these huge things here, these are cutting shears,
Yeah. And you've got three main types. You've got a standard cloth cutting shear, which are very sharp. You have an overcoat cutting shear, which are not used very much these days because overcoatings are about between half and a third the weight that they were when these were made. And they're also very sharp and more powerful. And then you've got paper shears, which are very blunt.
Oh, and these are for cutting out the patterns, aren't they?
Yeah, because you want the shears to grip the paper when you cut the pattern out.
That's interesting because, in surgery you have different kinds of scissors. Quite often they're a bit smaller than yours, like these ones, but they're usually blunt-ended so that you can use them you can open them and sort of separate structures without cutting through them necessarily.
Right.
So I think a lot of it is about how you learn to use your tools, isn't it, and how they connect with the materials you're using, whether it's living human organs or whether it's material.
So for example, if you're trying to cut around a corner with a sharp pair of shears of paper, you won't be able to because it will cut too quickly. You need the gripping of the paper as you go to be able to get around the corner. And
did you find? Did anybody sit you down and say, Joshua, look, here's how shears work, or did you just have to learn that on the job? No, you just learn as you go. Basically. Okay. And hope you don't make too many major errors in the process. So you spent 5 years or whatever it was as an apprentice jacket maker, learning all these skills, but never seeing I was going to say a patient, never seeing a customer.
No.
And then your next apprenticeship, your second one, was as a cutting tailor.
Yeah.
And I found that even more interesting. Say a bit about what being a cutting tailor is.
So the cutter or cutting tailor is the person that develops the garment. So you have the interaction with the client, you interpret his figure, his tastes, your own tastes, the materials, his lifestyle, his movements, and put all of those things into one package and try to come up with a solution.
So at this stage, the package is in your head.
Yes.
You're making sense of that person.
You're trying to take in as much information about all of the things which will determine what the garment will come out like.
But you haven't yet completely decided what that garment will be. You may have a sense, I guess, but not.
You have a sense of direction, but you don't want to trap yourself into predetermining exactly what it will be, because you don't, especially if you've never met the person before, you can't collect enough information in one meeting to then determine definitely that's the right result.
So this is sounding a bit like those stages I was mentioning, the connecting, the establishing of rapport with somebody and gaining information, and then maybe the summarising, the sort of testing out whether your ideas and his are on the same wavelength.
Yes, no, exactly. And I mean, a lot of it you learn from talking about other things. So you might not be talking about the garment itself. You might be talking about the politics or anything. You're trying to build up a mental picture of the person in their entirety as much as you can in the time that you have.
And so presumably you're also looking at them physically and seeing what sort of shape they are in.
Yeah, I mean, because when you measure people, typically people don't tend to stand very naturally. They tend to stand a bit like they're in the military. And so you want to watch them whilst you're talking to them, both in their movements, but then also in what is their more natural posture, so that you don't end up making a suit that fits them only when they're stood much more erect than they would normally be.
And so all of this is something that's going on in your head, but presumably you're not necessarily discussing all that with the customer.
You can't discuss that. The idea is that you take all of that in, you make a fitting, and you try to have as few cul-de-sacs as possible. So you cut it to be able to go in as many different directions as you can.
So let me see if I've got this straight. You see them the first time, you come up with a design, you draw it out, you cut it out, you send it off to the making tailors.
Yeah.
Who come up with a kind of sort of scaffolding. I mean, an incomplete version, is that right?
Yes, yeah. So they come up with a based fitting, which is generally something along the lines of this, which has the interlinings inside, and it mimics various aspects. So this is to mimic the pocket, the thickness of the pocket, and so on and so forth. And having that, at this point, I've got lots of cloth here, I've got lots of cloth here, I've got lots of cloth in the shoulders, and so I can recut it in all sorts of directions.
Oh, I see. So you're seeing it for the first time on that person.
Yeah.
And then you're making decisions about what needs to be changed.
Yeah, and with them, so you can experiment a little bit. So I have one person I'm working with at the moment who had the same tailor for 30 years, and unfortunately that tailor passed away, so he's now moved to me. And he's used to a certain garment. Now that garment may not be the best outcome for him, but you also have to be sensitive to the fact that he has that history of what he feels comfortable on him. So through the process, that's quite an extreme example, but through the process you need to take the person with you so that they trust the process, so they can see the changes you're making and be comfortable with those changes. So
this isn't just about creating something that's a perfect fit, it's about it's a sort of persuasive thing, is it? By getting that person to be comfortable with it.
Well, they need to be comfortable with it. You need to come to a shared agreement of what it's going to be. You'll only find that through the trying on, and it's also a question of the sensation of wearing. It's quite different to what it looks like. Generally speaking, nobody wants a perfectly fitting garment because they want to look better in the garment than they do without it on. So that's an interpretation of what that better is.
Yes.
Is what I mean.
Yes, I do. Yeah.
So, when somebody asks for a perfectly fitting suit, no such thing exists. You can have the best representation of that person in your mind and in the mind of that person.
So in a sense, it's a compromise, but it's
always a compromise.
It's a middle
Yeah.
position between
Yeah.
what they look like and what they want to look like and what
And
they
how
feel
they
like and all
move
that stuff. And,
you know, like if they're
Yeah.
muscular, then
Yes.
there's going to have more expansion and contraction
Yes.
than they would if they're
Yeah.
not.
Now, I was thinking about this in the medical context because as a GP, often I would be trying out, there would be a number of different possible ways you could treat, I don't know, somebody with asthma, say, or with high blood pressure or something, and you'd have to, it was a collaborative thing, you'd have to try things out, and they might be this kind of inhaler or that kind of inhaler, and some people would be more comfortable with one or the other. And, there was a lot of stuff that the textbooks didn't tell you. That was very much about, I think, the process you're describing of trying to work out what made somebody tick and what their life was like and what would work for them and what wouldn't.
Yeah.
And again, starting with something and then seeing what needed to be changed by seeing them on more than one occasion.
Exactly.
And I think what you're saying is something a bit like that.
Exactly, and the fittings are not just to get it to fit, it's to get it so that it's something that's right for them. I mean, so for example, if I'm making for somebody in Singapore or somebody in Rome, what the outcome has to be completely different because the lives they live, the circumstances, the aesthetics, the climate, everything's different.
And so this is the difference between a bespoke process and a made to measure because the outcome has not been predetermined in advance.
No, exactly. And you're not going from something that pre-exists. So a made to measure suit, you have a block pattern, a defined pattern, and you adjust that pattern to the person until they're happy with the way that it fits. But it's still that pattern, if you see what I mean. But
in your case, presumably like an architect, you have to be able to start from scratch. Another way would be to say, look, here are the patterns I've already got, and I'll modify one for you. But you're not doing that. You're able to design it from the beginning.
Yes, you start with a point on a piece of brown paper, and you work out from that. And it's the same with the way that it's made. You can change the structure. You can make it much softer. You can make it much stiffer. You can change the way the shoulders are. All aspects of it are open to change.
So when I was talking about pi and the workmanship of risk and the workmanship of certainty, did that make sense to you?
Very much, yeah.
As a way of looking at it?
No,
when I encountered his work, I thought that was quite an interesting sort of shaft of light on all of this.
Yeah, and there is a big risk involved, but on both sides. Obviously, I have to make sure the garment's right before the person can take it, but also there's a risk for them because there's time involved.
Of course,
and not everybody really wants to spend that much time doing something like that.
And so, just to be clear, these fittings happen on different occasions.
Yeah.
And in between two fittings, the jacket goes back.
So the jacket then gets taken apart and then recut. The pattern gets recut.
Oh, it gets completely dismantled.
Yes. Yeah. The panels will get taken apart. You, as I say, recut the pattern, recut the garment, keep notes of all the things you've done, and then get it ready to the next stage with the changes that you think need to be done.
And you might do that more than once?
Oh, yeah. Do it as many times as you need to do it. There isn't a fixed...
So, it could be 10 or 12 times if it needed to be?
Yeah, if it needs to be.
And so, is that what you meant about somebody having to put in their time?
Yeah,
yes.
Exactly. As I say, sometimes you will get somebody that says, I only want to fit it once, and you have to do the best you can with that time. Other people will keep going as many times as
And so, are you having to gauge the level of risk that... I have to be careful with this word risk because I say again, this is not talking about the risk to the quality or risk of personal harm or anything, but are you having to gauge the level of uncertainty which people are willing to accept in coming up with something that cannot be completely predicted?
Yes, exactly. And sometimes it can be in the initial garment, but sometimes it can be in future garments, because if somebody's had something they like, and then you say to them, well, that's great for that garment, but we're making something for a different environment, so it needs to be different, they might not necessarily want to have
so if you're suggesting a different cloth or something?
Exactly. So if you're suggesting something more casual or for something for hotter weather, or the result should be different, really. But not everybody wants that. They want the predictability of knowing what it is.
So So a lot of this must be about gauging an individual and the level of uncertainty they're happy to tolerate.
Yes, exactly. Yeah, and you have to build up a picture of that and work within the parameters that you're given.
Yes, I mean that's very interesting because that makes sense to me as well as a clinician. You know, you're having very much to try and work out whether to try something new or whether to suggest something different, or you know how long to give something before going back to the previous one. A lot of those things that you've been talking about, I think, have counterparts in the world of medicine.
Yeah.
I mean, in the last couple of minutes, because we're getting towards the end of our time, I thought, you know, from my point of view, our collaboration and working together has been extremely helpful in helping me think about my own world, really. And I wondered to what extent that worked the other way around, you know, whether thinking about medicine shines new light on tailoring.
Well, it does, and it also makes you open your mind up to the possibility that things can be different, because obviously medicine progresses a lot more than tailoring has in most things, and as a result makes you realise that just because something's always been done in a certain way doesn't mean that's the limitation to which it can be done, if you see what I mean.
But I guess that's not the same with all tailors, because, I mean, presumably because there is this tradition, is there a sense that people go to a tailor knowing exactly what they're going to get?
Yeah, and to be fair, that was the tradition of Savile Row. It was they always made the garments to fit people, and they always cut a pattern for that person. But normally they had a house style, and you would go for that house style, and you would go to a different house for a different style. So if you wanted dress tails, you would go to one tailor. If you wanted a shooting jacket, you would go to a different tailor. And that's not really what I do, if you see what I mean, because I don't think it's not a very interesting process.
Yes, I can see that. And finally, I mean, I didn't have a chance to talk very much about this final stage of becoming a master and passing things on. I mean, based on your experience with your own master when you were an apprentice making tailor, and thinking how you might, I mean, what was your experience when you were a cutting tailor? Was it similar?
No, it's completely different. The person that taught me cutting tailoring was, he was much more open. He was much more descriptive, much more encouraging. Could be quite, but equally as a result, when things did go wrong and he made you aware of that, it actually cut much more. I think if I'd had the person that taught me cutting teaching me making, it would have been easier. But I still naturally gravitate towards the cutting. So possibly it's hard to separate the two out.
So in terms of, I mean, there isn't quite such a formal structure of learning, I guess, in your world as there is in medicine with medical schools and all that kind of thing. Are you teaching young apprentices, or does it not quite work like that?
The way I work, I think, would be very difficult to teach. Doesn't mean it's impossible. I think the difficulty is that you need repetition when you're learning, and what I do by its very structure means there isn't repetition because it's different each time. And so that's a potential challenge for me.
So do you think that somebody going into becoming a tailor needs to go through that sewing tailor's apprenticeship of just doing things again and again?
I think so, but I think it's also the same for cutting, that you need a more structured approach to the way that you learn cutting than I would have.
I mean, I feel we've only started to scratch the surface of all the things that we could be looking at in terms of parallels between bespoke, bespoke in tailoring, bespoke in medicine, and indeed between Savile Row and medicine. But Joshua, we'll have to leave it there because it's time to close this and ask for questions. So thank you very much for taking part in this lecture.
Thank you.
We've had some interesting questions from the audience, and one of the things that's occupying them is this distinction between makers and cutters. One of the audience members has said, in construction, we have builders and consultants, like makers and cutters. Builders may earn more, but consultants have more prestige. Is there a similar divide in tailoring, or is it different?
Historically, there was very similar. There was a definite divide in terms of prestige. The cutter was very much the boss and the maker was working for the cutter. I think that's dropped off a lot, and certainly for me it's a collaboration rather than of equals rather than like that.
Thank you. There's also an interest in this concept of repetition in the early stages, and not knowing why what you've done is better than than the earlier stage. It's a difficult concept. It must be very frustrating. Is it the case that you eventually come to understand it, perhaps at the journeyman stage, or
you do eventually? But as we were talking about, it's more a question of feel. So it's not necessarily that easy to describe. So you do start to get a sense of the feel of when something's right. So, for example, when you're putting on a collar, the tension of the collar's longer than what you're putting it onto, and the amount that you put, the amount too long it is, you only get to feel as you go. And so to start with, you've got no idea, and the person you're working with has a look and it says, no, that's wrong. You need to put more length or less length, whatever. After a certain period of time, you begin to get a feel for that.
And I think it's the same. I mean, certainly, in my experience in surgery, something rather like that, where you're putting let's say two bits of intestine together, and they have different diameters. Maybe you're putting some intestine onto a section of stomach or something like that. You're having to make very similar judgments there, but a lot of that is about learning to feel in your fingers, something that's very hard to put into words, but it's about what your materials will allow you to do. And you kind of get a sense of when it's right. It's not too tight so that it's going to heal badly. It's not too loose so that it's going to leak. You get the feeling of when it's just about right. But at the beginning, you just don't really know that. And I think there's really no substitute for doing it lots and lots of times, certainly in my experience. Does that make sense?
Yeah, no, it does. It makes sense completely.
there's some interest in the tools as well, the tools of the trade. Yes. You spoke about the scissors, Roger, not having very pointy ends, so they can be used, if you like, as a probe. Or, and then the shears, the pure goodness. One of the questions surrounds this making of mistakes, because you've said no one really instructs you on how to wield the shears. Mm-hmm. And you're working with quite expensive material and indeed with human tissue for the scissors. How do you deal with that pressure of, I guess, making the first cut and not making a mistake?
Well, I made a mistake on my first day and cut a hole in the cloth, so I guess in a way I got it over with early. But I mean, you tend to go very carefully and very slowly, and you're also given simpler things to do, so that there's less chance of you making colossal mistakes.
Right.
And it's the same in surgery, where you're very much part of a team always. So you to begin with, as I said, you're holding things out of the way, and then maybe you might be invited to cut the stitches that a surgeon has made. So that he can then go, he or she can go on to do the next one, and you gradually become absorbed into that group of people, and then they might give you little things. It's not as if one day suddenly, first time ever, you do an operation. It doesn't work like that. It takes you years to become sort of absorbed into that way of doing. But it does take a long time, I think, to recognise those, particularly those issues about what your materials will allow you to do. Mm. A bit like Mr. Black and you put your finger in there and feel the example. I think, when I've seen you feeling cloth and sort of recognising, getting a huge amount of information from just a couple of seconds of passing a piece of fabric through your fingers, you clearly have got all that sort of knowledge inside, haven't you? Yeah,
and you can feel whether the tension's right on how stiff it feels and things like that.
Yes. And I think that's why the whole process takes so long.
Right.
And that's why you can't condense it into 3 months or something.
No, exactly.
It takes what it takes.
I mean, if you making a jacket, you could read a book in a day and you theoretically would know how to make a jacket. It doesn't mean you can do it.
Quite. Is it heard of that surgeons have their own styles in work, like tailors do in tailoring? Is there room for this?
Oh, absolutely there is, yes. And I mean, one of the interesting things about being a trainee in surgery is that certainly when I was doing it, you would spend quite a time with one surgeon and then move to another one, and you would see those different styles and different approaches. And as you were saying, you can learn things from all the people you work with. You may or may not want to adopt those things, but there are certainly definitely styles in surgical practice, and indeed very clearly in the kind of clinical practice I was doing when I became a GP, where patients would know that, and they would come and see this doctor or that doctor, not so much because they felt they had more or less medical knowledge, because we're all equally qualified, but because they felt more comfortable with one approach or one style than with another. And I think that there's always that question of individuality and style, and I'm sure it must be just as much the case in
very much so.
bespoke tailoring.
Yeah, and even two people that learn from the same person, there will be commonalities between what they do, but they will have differences. And it's one of the main differences between tailoring in the UK and tailoring in Italy. There's an example that in the UK, one person makes the whole garment typically, whereas it's subdivided in most other places, which means you get more commonality in the work, but less character, because it's not an individual craftsman making the whole thing.
As a tailor, you are aware of the wishes of your client in terms of their hoped-for representation of themselves in the world. What might doctors learn from this approach in their attitude towards their patients?
Well, I mean, that was one of the most fascinating things I found about this collaboration with Joshua, is that I think at the centre of what we do for both of us is attentive listening and attentive looking, and physically looking and listening, but also trying to work out what it is that a person is all about. Trying to work out, I mean, as a GP, I found very often the problem was not so much knowing what to do to treat a particular thing, but trying to work out what the problem was in the first place, because patients would often come not knowing exactly what was wrong. Something wasn't quite right, or they just they had a sense that something was not as it should be, but they couldn't put their finger on it necessarily. And I think you sometimes get, I mean, people don't always know that they want a three-piece grey suit with this and that, but they, and that's a human process. That's not so much about having the skills to make things, although those are, of course, essential, as is medical knowledge and all the rest of it. But I think it's a process of trying to move your attention from yourself to another person and try to work out what it is that they're about. And I've heard you talk in very similar ways about your customers.
It's very similar, and even down to the way that something feels on somebody. They can't necessarily describe what it is about it that feels odd or how they would want it to be changed. And it's my job to work that out and kind of find ways which allows them to find out what's right.
And I think from my point of view, I mean, certainly as a medical student and then as a hospital doctor and in various things, I had focused very much on medical knowledge and component skills. And so it was really, when I started working with Joshua, that this fell into place for me, how much I had changed later on in my career and how important what we've just been talking about is to the process. Of course, that other knowledge of what to do next is absolutely essential, but actually it only makes sense if you are able to work with another person in that relationship of trust and care to try and work out with them what the issue is and then collaboratively come up with a plan of what to do about it.
Okay. I think the final question probably is about the intersectionality between your two expertise, your two areas of expertise. And one of the audience members was wondering if you could say a bit more about how you transmit Joshua Byrne's knowledge to the medical students, and perhaps vice versa, if it works that way too.
Well, from my perspective, I mean, partly I do a lot of teaching anyway, because my role at Imperial, the university where I work, is in surgical education, and I lead a master's program in surgical education with surgeons who are interested in that area. And for many, many years now, Joshua has come and taken part in that program, and we've used that as a sort of springboard for exploring these ideas that for many surgeons I think are unfamiliar, because they come completely outside the world of surgery. And people in medicine don't normally have the opportunity to engage with bespoke tailors anyway. So I think that is one of the ways that I've tried to bring this kind of way of thinking into the teaching that I do. But more generally, I've tried to write about it and to, I think, encourage people in the world of medicine and science to think that looking outside those disciplinary boundaries that can seem impermeable is actually very productive, because it changes the way that you think. Once you recognize that you are in a completely different area of expert practice from somebody else, but that there is common ground in how you approach your work, even though that work itself may be very different, you start to get unexpected insights. I don't know if that's...
Yeah, no, very much so. I mean, I don't have students and things like that, but certainly the collaboration has influenced the way that I look at my work, and also the way that I interact with the people that I work with. And it's very much that looking at where the boundaries are and realising that possibly they aren't boundaries and that they're manufactured boundaries. So to me.
Thank you very much. Thank you to both of you for, as I said, a very fascinating session tonight. It's been really interesting, and I think the audience has enjoyed it as well. I am sorry that we weren't able to get to all of the questions this evening, but I would like to thank you both for the presentation, and to thank our audience members as well for attending. Professor Kneebone's next lecture will be entitled "What Surgeons Can Learn from Polar Explorers and Fighter Pilots," and that's at 6 p.m. on Wednesday, the 6th of January. So please do return and join us for that. Thank you.